Good afternoon. Thank you all for joining us, and I apologize for the momentary delay. We did have a little technical hiccup today, and we're hoping to get moving and get on with this session. So first, I would like to welcome everyone to today's PartsSource HTM Leadership Series. Today's presentation is the sixth of our 7-week series that will wrap up next Thursday, November the 12th. Today's session, Workflow Improvement, Integration is Optimal for Success, will be presented by Don Gabrielson and is hosted by Mara Pare. Before we begin, I'd like to review a few housekeeping items. First, you have a control panel at the top or bottom of your control screen. This control panel can be minimized or expanded. Also within this control panel, you will see the Q&A button. You can submit questions using this question portion of your control panel. We will answer questions at the end of the presentation. If for some reason your question is not answered, we will respond to you individually after the event. All registrants will receive a link to the webinar recording after the event. This information will be sent to the email address with which you registered for the session. And now allow me to introduce our host, Mara Pare. As Vice President of Client Solutions at PartsSource, Mara works closely with leaders in clinical engineering and HTM to design and implement data-driven programs that transform procurement through evidence-based decisions to improve efficiency, cost, and quality. With more than 10 years in the industry, most recently prior to PartsSource with Allina Health, Mara truly understands how to build in-house HTM programs, streamline and consolidate purchasing and vendor management, and execute on service strategy that not only contributes positively to an organization's bottom line, but also ensures a safe and timely medical equipment experience for patients. Mara now partners with members of the PartsSource Pro community to support their HTM and supply chain goals. She also holds a Bachelor of Arts degree in Global Studies from the University of Minnesota. Now I'll hand it over to you, Mara.
Thanks, Colleen, and thank you everyone for joining us today. At PartsSource, we believe in continued knowledge sharing within the HTM community, and we really embrace partnership with our many stakeholders in the industry, which includes healthcare systems, their providers, staff, OEM manufacturers, suppliers, and service partners. And the goal of this leadership series is to really connect that HTM community through discussions of topics that are shaping the future of clinical engineering. And I'm happy that one of those topics today that we're going to discuss is workflow improvement, and presenting on this topic today is Don Gabrielson. So Don is an asset administrator in Mayo Clinic's Enterprise Healthcare Technology Management Division. He is responsible for developing an enterprise lifecycle management plan for Mayo's medical systems and equipment. And most recently, he led Mayo Clinic's CMMS and parts workflow integration project. Don also serves as secretary for Mayo Clinic's Medical Equipment and Technology Standardization Subcommittee, which is responsible for the enterprise standardization of medical devices. He holds a Bachelor of Electrical Engineering from the University of Minnesota, a Master of Electrical Engineering from the University of Minnesota, and a Master's of the Business Administration from the University of St. Thomas. But perhaps most importantly, Don is a big Minnesota hockey fan, and he catches Minnesota Wild games whenever he can, so go Wild. And now I'd like to pass it over to Don to continue today's presentation.
Thank you, Mara. Good afternoon, good morning to some, or maybe you're viewing this on a web recording. And special thanks for coming out today with COVID numbers increasing across the country. Many of our hospitals are seeing increased census. I know at some of our hospitals that's also relating to shortage of staff, so thank you for joining today. Go to the agenda slide. Yes, thank you. A little introduction about not myself, but Mayo Clinic and our Enterprise Healthcare Technology Division. Kind of our previous states of part ordering and our previous states of CMMS, but then really focus on our current state. We recently implemented and went live with Novolo CMMS, and we have tight integration with PartsSource, which I'll go into. And then some takeaways and best practices that hopefully you can take back to your organization. A little bit about myself. I'm an electrical engineer by degree. I'm coming up on 14 years at Mayo Clinic, about 5 with in healthcare technology management. 5+ years ago, my manager goes, Don, you want to be a program manager, physiological monitor project? I'm thinking monitors, just go to Best Buy and buy one. Well, that was my knowledge of HTM and medical devices. I haven't even heard of HTM or clinical engineering, biomedical engineering, and I've had a lot to learn. I have learned a lot, and it's really been a very, very good transition for me. As Colleen said, you can ask questions. Please do ask questions. We'll get to them at the end. A little bit about Mayo Clinic. The next slide, please. This just kind of shows, people have heard of the Mayo Clinic, but they may not be aware of how broad we are. We're concentrated in southeastern Minnesota, western part of Wisconsin, and then we have flagship hospitals in Scottsdale, Phoenix, Arizona, and also Jacksonville, Florida. Go to the next slide. So our healthcare technology management division, you can see here we're coming up on 300 team members. We hopefully will grow that by 30 to 40 by the end of next year. Our managers, we have a large support staff to really help the technicians manage the equipment. 26 shops in 5 states. So we're looking at, you can see here, 126 pieces of medical equipment, valued over $2 billion. So it's a pretty large and wide breadth of responsibility. So not only do we have traditional biomed equipment and imaging equipment, but we have a very large lab, not only a lab that supports Mayo Clinic, but we have a reference lab, which is very large. We recently started supporting connected care, so we're supporting those devices at home. And we also have a unit for cybersecurity, which is, we believe, leading the game of how to manage the devices from a cybersecurity standpoint. So it's the breadth of what we do is really quite large. Next slide. So where did we come from? As I said, at the end of September, we went live with a new CMMS. Previous to that, TMS was our CMMS. Technicians ordered parts via PartsSource. There's a punch out. They ordered parts. Now, if you work for PartsSource, close your ears for a minute. We ordered parts outside of PartsSource. We ordered them in our, excuse me, our Lawson ERP. But all these disparate systems, they didn't talk to one another. Technicians had to go back and forth between these systems, and the data was scattered of, for the data of how we manage our medical devices. Loose or no integration with CMMS, definitely less than 10% of our parts ordered were reflected in the CMMS. Why? It's actually worked for the technician. I take the easiest path, as a lot of people do. So if there wasn't a direct value add to add that order into the CMMS, because there's a kind of a manual process, they didn't do it, and I don't blame them. Cost of service ratio, most people are probably familiar with that. And at Mayo, we pay keen attention to that. We use it very heavily in HTM, and we look at it across our 7 different regions that we practice in, across the different modalities. But to be honest, and it was pretty extensive, but it was good and accurate at the macro level or at the modality level. So we could understand our cost, and we could relate our cost to a modality, but it really fell off after that. And then, part of my responsibility is looking at device replacement, fleet replacement. So, what was the history of those ultrasounds or whatever device it is? Really, we had anecdotal data for that. We could look at, how many work orders that they had, how many corrective maintenance work orders they had. But our cost data was, not very good. So at a macro level, we believe we were very good because we looked at all the costs, all the charges that we did, and we assigned them to the right modality. But it kind of stopped there. We didn't get into more detail that we definitely would like to have. Next slide. So with the implementation of Novolo, and I'll also say that, this presentation, we're going to talk about Novolo. Our ERP at Mayo is Lawson, but these discussion points are relevant to whatever CMMS you have and whatever ERP you have. Our vision was to have an electrician to never have a reason to leave Novolo to do the ordering, to do their work, to do their work. So that was really our vision, and we've achieved that to a very, very large degree. The technician will start in Novolo, and if they need parts, they're going to get that part either through a punch out through PartsSource, but it's really they get a sense they're never leaving Novolo, or if they order a part via the Lawson process, they add from a work order, they add the parts through interconnections through EDI. We pass all that information back and forth. Lawson does the ordering and gives the information back to Novolo. And as it mentioned here, a lot of it is done via EDI. And what's not shown here is between Lawson and Novolo, Mayo made the decision to kind of intercept the Lawson orders, the Lawson interfaces. So that sits in our ServiceNow instance. And then the reason we did that is HTM is really the first to use Lawson on a ServiceNow platform. And it's was recognized at Mayo. There's a lot of other customers that are going to want to order parts from Lawson, and we have stuff migrating to ServiceNow. So let's get that interface data into ServiceNow so other people can use it. But what did this mean for implementation? It was complex. It was. We had, from a Mayo standpoint, we had two vendors involved. We had Novolo and we had PartsSource. From the Mayo side, not only did we have our HTM people, but we had some Lawson experts and we had our ServiceNow experts. So there's really 5 different groups of people that worked together, but it was just an excellent working relationship. Everyone had a great attitude, but it wasn't easy. With integration, we did find problems, but we fixed them, and it's gone very, very well. One thing I forgot to mention with our previous state is if a technician wanted to expedite a part because it needed expedited shipping, it was a manual process and a multi-step process. It was really kind of ugly in my opinion. They placed the order in Lawson, and then they had to create a high priority ServiceNow ticket to say, hey, this is a rush order. So then the Lawson people had to get that and then contact the vendor. So it was not a good process. It's extra time, and manual means, well, it can be error prone. So with this integration here, all the information is we have in Novolo, and I'll show on the next slide in a minute kind of what that means. In our previous state, it took 10 to 15 minutes to order a part, to go into systems, do all this stuff. And now we're looking at 90 seconds. Initial feedback from technicians have been very positive. It's still just anecdotal data, but it's easier, it's faster. And from HTM leadership standpoint, we're going to have a lot more data than we did before. Next slide. So what kind of data do we have now that we did not have before? Well, we have detailed parts data. The vendor parts, the condition of the part. Was it new? Is it used? Is it reconditioned? So we have all the kinds of part data that we had before, but is kind of separate part data. Along with this, we have our labor, either our internal labor or our vendor labor. And associated with that is travel. If a vendor travel and also internal travel, because we do have our hill system sites, we travel amongst them, so we want to know what kind of windshield time our technicians have. And then the parts order status, as I mentioned earlier, we don't want the technician to leave Novolo. We want all the information in one place, and they have that. They have the parts information between PartsSource, Novolo. There's probably 10 different statuses of the order that gets continuously updated as it moves through the stages. But we also get that from our Lawson shop. When a part is received on our dock, Lawson updates that status, and the technician is notified within Novolo, so they don't have to go out to different systems. They don't have to be monitoring the email, which is maybe a traditional way that they would have gotten this information. Again, all this is brought together. The technician who ordered the part. Well, it may seem obvious, but how come Joe is ordering these parts from a non-preferred vendor? So we can see trends, and especially across our large division, we can see trends across, within a shop or, across the country of parts ordering, good things and bad things. And we look at trends and we can feed that back because we want a standardized Mayo practice. And our CEO has said they want a patient experience to be the same no matter what door you walk in at Mayo Clinic. Well, we want that too with our technicians and maintaining our medical devices. So all the part is also, it's obvious, or I don't know if it's obvious or not, associated with an asset. So all the information about the asset, what make it is, what model it is, how old it is, all that information about the asset is tied into that parts order. Or you can look at it the other way. The asset has all this part order data. And then all the information about the work order. A lot of these data points have to do with the work order, but all the points of the work order. So all of this is available, it's integrated all within the CMMS, so we can make a lot better decisions in the future. Next slide. So I've mentioned that a lot of, we really have one-stop shopping for our technicians. It's really, it's in with Novolo, and it's much more efficient for them. They don't have reasons to leave Novolo. Now this is a little bit detailed, but I'll get into it. So we have three methods or three avenues for our technicians to order parts. We have the PartsSource flow, which is actually the easiest for the technician because they just go to their punch out to the PartsSource, they add all the stuff, all the itemized costs that are associated with that order, brings back into Novolo, and it's done. If they go the Lawson route, they have to do some of that. They have to pick out the parts themselves, but they're used to doing that. So the PartsSource flow that we have, and that uses, it's a Lawson RQ500 interface, which probably doesn't mean a lot to a lot of people. Another flow we have is our Lawson special order flow. The key here is that it uses the same interface, which is good. Now, when we're doing the integration, the group asked or said, well, we order parts Lawson special order. And I go, what the heck is that? From a dumb project manager, that name was, I thought, didn't make a lot of sense, and we should change it to something meaningful. But the feedback was, they corrected me, and it was meaningful to technicians. They knew what that meant. These are not parts that are stocked in a Lawson catalog. They're not like batteries, something that can be reused by a lot of people. They're a special order. So that's why they're called special order. And it's meaningful to technicians. So we kept that. And the third avenue, you notice it uses a different Lawson interface, the PO520, is our block and our rush order process. So this process really puts the onus on the technician to contact the vendor for all the parts detailed, the shipping, everything that they need. And the job of Lawson here is to simply pay the invoice when it comes in. However, we notice an opportunity because a lot of times when technicians want to rush an order, they do that. They call the vendor and say, I need this part here tomorrow. They've already done that, and they kind of use Lawson as a back end. So the advantage here now is our rush order process is automated. We don't have to have these different process. It's a manual process for people to pick up and hopefully work. So the rush order process is automated. It's much more efficient and better. Integrated part ordering status. I kind of mentioned that the technician does not have a reason to leave Novolo. They're going to get the very dynamic status of their parts ordering within the CMS, within Novolo, which is very beneficial to them. So they can get, it's a one-stop shopping. What did this do to our cost of service ratio? Well, cost service ratio, as most folks know, it's the cost of the parts to maintain the parts. In the numerator and the denominator is the cost of the acquisition of the part. But now we have micro level data. Our leadership is very excited about this. And we can tell at a micro level, all the costs that are in the numerator of the cost service ratio, we now have detailed information as. We can use this at a fleet level. It's time to replace our ultrasounds. Well, what is the status there? What is the cost of maintaining those? How do we see that? How is that cost trending? Or if it's, we can look at that to look at if it's time to replace an individual piece of equipment. Well, how many work orders are being that? What does it cost us to maintain that? A lot of what we have done at Mayo in the last, we've been an enterprise division for, I don't know, 4+ years. And we've grown it tremendously, but we've grown it by reducing vendor service contracts. And we've done this now. Historically, I mentioned we have, the cost service ratio, we know it at a modality level. So we've used that. But when our leaders look at this information, one guy showed me, he just puts all these work orders in a file, he prints them out. And when it's time to analyze the cost of maintaining the device, it is sheets of paper he manually put into a spreadsheet. Well, those days are gone. You'll be automatically have that all information into an Excel spreadsheet. So it's going to make a better, robust, and faster process for us to look at a cost service ratio. What is the total cost of maintaining that device? We'll have much better data. I'm looking at my cheat sheet. I think that's all I had. My wife says I talk fast, and I must be. I'm going through this rather quickly. So what are the takeaways that you can do for your organization? Again, this integration of the CMMS with our ERP, with PartsSource, it definitely made it much more efficient for our technicians. Anecdotally, as I mentioned, we've gotten that feedback. They like it. It's easier. And they'll give them, free up time to do the work that we're paying them to do. We don't want to, we're paying them to fix and maintain equipment. So now it's more value-added work, excuse me, for our customers and they do their day job that we really want them to do. Kind of a side note is that, we partner with other organizations, other departments within Mayo Clinic, and they want access to our CMMS data. Historically, we've not done that too much, but we've gotten several requests of they want access to our CMMS data. So you pick your department, radiology, surgery, whatever it is, they want information about their assets, how much, because they're basically are indirectly paying for this equipment and maintaining it. What are their costs associated with that? And we will get to that, and we want absolutely to get to that. We're about a month plus from go live, so we haven't done that yet, but we'll get to that soon. But the advantage there is, I mentioned this Chinese proverb that a man with one watch knows what time it is. A man with two is never sure. Well, that was a situation that we were in across Mayo's. We had two sets of books. We had our value of the asset, what it cost to purchase it, and what's depreciation costs. Where Lawson had, they kept their own set of books. So which one's the accurate one? Well, Lawson's what our accounting goes by, so that made it accurate by default, but it was not accurate. We looked at that, and there's a lot of inconsistencies and just wrong data. Lawson has stuff in their entries, equipment that's long been retired, so it's not accurate. So now we're getting to a place where we're going to have, they will use our CMMS for the value of the part. So it's going to be more accurate data. Same with our surgical practice. They typically just kept in an Excel spreadsheet of all the equipment in surgery. Well, that's as old as the day you print it or the day you export it. So now they want direct access to our CMMS. So we're all looking at the same data. We all have very accurate data. I mentioned the the so much more better and thorough data we now have for our cost of service ratio. Um, to me personally, I don't think there's a lot of value in discussing if my cost service ratio is lower than yours across organizations. Because that numerator, I know there's attempts at standardizing that definition, but it's difficult to do. But we've used that, as I mentioned earlier, within Mayo Clinic, because we calculate that the same across our entire organization. So we have used that to benchmark ourselves for where can we reduce our service cost across our organization in the different modalities. I mentioned now we can do a much better job of fleet replacement. As many of you probably do, you have some type of score of when it's time to replace the fleet devices. I mean, age of equipment, the cost of maintaining equipment, many factors. But it's gonna be, I don't want to say push button, but we can create a fleet replacement score, much like you do a risk score for your equipment, and all that data will be within the CMS, and it'll be much better. As I mentioned earlier too, from the device standpoint, we have detailed information about that device, that this device is acting bad. We get comments from our customers. So now we have a much better detailed information and data of how that individual device is performing. Data is more accurate and consistent format. I've kind of indirectly mentioned that it is consistent, and we're going to have much better thorough data than we had before. So from a technician standpoint, it makes their job easier, more efficient. From a leadership standpoint, we're going to have much better data, more accurate data, and faster data than we had before. So with my quick talking, I am done, and we have time for lots of questions, hopefully.
Right, thank you, Don. So just to reiterate to everyone, at this time, you can submit your questions using the question section of your control panel. We'll take the time to answer as many questions as we can today, and we'll give a few minutes for additional questions to come into the queue. We did get a couple questions as you were speaking, Don.
I do see them, yes.
Okay.
I'm not sure what Jose means about the cost to get all of it talking to each other. It was part of the integration with Lawson, with PartsSource. I think, let me back up. For Novolo, we integrated a few other systems as well. So they estimated 800 hours of integration time on the Novolo side. I'm pretty confident that they far exceeded that. And then internally, it was just out of hide. I mean, as I mentioned, the group was very supportive, working together in a very collegial, fashion, and it was very, very good. From start to end, our implementation with Novolo was about 15 months. It's a very long time. And I would say the integration of Lawson and PartSource was a large contributor to that. I should back up and say, advantage that we had starting was that PartSource and Novolo already had integration. They had already implemented this integration, so that simplified that process tremendously. A big part of the time was for Novolo to understand the Lawson interface. And then also, as I mentioned, our ServiceNow team interrupted the Lawson orders, so they had to interpret that as well. So we had some timing issues. You always expect some issues of that, but it was a big benefit to us that PartSource Novolo was already integrated. We did find a few problems with that integration, and also with the problems, we did a few small enhancements. Well, you didn't think about this, so it was that was very, very good. Hard savings, it's too early. As I said, we've been on this integration since the end of September, so it's much too early to look at that or to analyze that right now. But we did, estimate just the technician savings time with the time savings of all these orders. So that's kind of easy to look at. Is that a hard savings? Well, maybe not, but so it's too early to look at the hard savings.
Hey,
Um,
Don, I was just going to add in response to the first question that was asked around the cost of these type of integrations, just from a PartSource perspective, integration with these systems is something that we provide as part of our PartSource Pro platform. So if you are a PartSource Pro member, that is part of and included with, the services that we provide on their behalf. So it was part of Mayo's PartSource Pro program to do all of the work that meant enhancing that integration that was already in place with Novolo.
all right, thank you. For depreciation, we use AAH guidelines, but it may be true in your organization. AHI guidelines says 7 years. Mail, especially with the devices that we maintain ourselves, we get a lot more length of time of service for that equipment, and we educate our users about that. There are some pockets of mail that says, "Oh, it's depreciated. It's time to buy a new one." We say, "No, it's not time to buy a new one. This is working perfectly fine." So for depreciation, we do use the AHA, but for useful life, we kind of have, it's not even a formal table, although we've talked about that as we get to more sophistication with our fleet replacement. But our fleet replacement will have, part of that is the age of the equipment. So we use AGA guidelines for depreciation, but understandably, we get a lot longer life out of most of our equipment than that.
Colleen, maybe you can read the question out loud that Mark asked. Sorry, Don.
Yes, sure. So another individual, Mark, has asked, what, if any, hurdles did you encounter with the Lawson integration, specifically in regards to time lag for PO creation or parts order?
We have not, I mentioned earlier, the hurdles we had were primarily for Novolo to interpret the Lawson interface. And again, it's a standing existing Lawson interface. So not only did Novolo and PartSource have existing integration, of course, Lawson has these standard interfaces. So that's why we specified in our statement of work that you will use our standard interfaces so Lawson doesn't have to change. So there is very little change on the Lawson side and very little change with a PartSource and Novolo implementation. But to understand that Lawson order, we saw problems there. We haven't seen too much in regards to time lags for ordering. We did experience some time ordering problems of the frequency and the specific time when our ServiceNow people will interpret that, intercept that order, going both ways, to Novolo and to Lawson. So we did find some problems with the timing there, and we fixed that. We did try, and there's also some just timing of when everyone looks at the files or when the files are sent. So it's not dynamic. It's like on the half hour. It kind of depends of when we do that. So we did find some timing issues there. We attempted during our integration to do, to try to flood the system with orders. So we, got a handful of people and we ordered like 50 parts within 10 minutes and to try to emulate that. And we did not experience any problems that way. Since our go live, we have encountered a few, again, it's more timing issues of intercepting those files, but they have been corrected and they've been one-off problems that, we did not experience during our testing. Part of our testing we're at the end is we did order real parts because I thought, well, this stuff is great. It looks good on paper, but I need to have a part at the dock. So part of our testing is to make it sure we go all the way through to get parts at the dock, because end of the day, that is absolutely what we need. So we did that in our test. And since go live, it's been a handful of one-off problems, but it has been very successful. It far exceeded my expectations.
We got another one that just came in, Don, from Tim. He's asking, did accounting adopt device descriptions that were built in Novolo? Does it follow or is it based on the ECRI description?
Boy, that's a hot, we've had hours and hours of discussion. So nothing was built in Novolo. And then we, at Mayo, we like to use standardized industry descriptions, classifications as much as we can. And we've gone back and forth of this so much. So we use ECRI as a base. We find ECRI is too much detail than we need, than we want, and that is meaningful by our customers. We use ECRI as a base, and then the subclassification, we've kind of lumped some of those together, or we do it ourselves. So we do have integration with ECRI, but we kind of intercept it, if you will, for the device classifications and descriptions, because we've looked at other standards as well, and we've just haven't found anything. ECRI, I said, was much too detailed for us and not understanding to many of our customers. So that's where we're at right now.
Thanks, Don. I also received a separate question. What has been feedback from technicians and or managers?
Positive feedback from the technicians. It's they like it. I was a little bit unsure. I knew the PartsSource flow was great, just because it's all there. You go to your basket and you order it, just like you do for Amazon. And all that information is fed into Novolo, and all that technician has to do is submit the purchase requisition. For the Lawson orders, I was a little bit uncertain because they had to add the parts manually to the work order, but technician had to do this yesterday, figuratively speaking, in Lawson, so they had to do that work anyway. So they found the flow. They find the flow better. Definitely an improved user interface. So positive feedback from the technicians. From the management side, I don't say it's a wait and see, nothing negative, but what I wanted to go there with is we have much better data. We just have not had it long enough to appreciate or to use that data. Kind of a sidebar with the parts ordering, with the dashboards and stuff that Novolo has, management does like that better compared to what they used to have.
Another question came in from Michael. It's totally unrelated to what we were just speaking about, but I think it's kind of with regard to education of the organization. So his question says, we have a nurse educator, but is there a title for a hospital equipment educator? Someone to educate RNs and techs on equipment and for new operators?
You know, at Mayo Clinic, we have a primarily internal education, and for our nursing staff, it is a nurse. I'm not the nurse educator is their title, but it is typically a registered nurse that does that education. And then if they want to use a new equipment, depending on the equipment, if it's, you know, on the job training, or does it manufacturer offer some type of perhaps online education? It kind of varies on the complexity of the equipment and what the manufacturer offers.
Another one, what types of benchmarking are you planning to do with the data beyond COSR?
Really at Mayo, we use a lot of internal benchmarking, and it's the cost service ratio is a large part of it. But as I mentioned before, we can use it to look at trends, and PartsSource has helped us in the past with the data that we've had with PartsSource to look at trends. Again, how come Steve is doing this? It's not a preferred part. So managers use that within their shops, but then we also unit, how come Arizona's doing this and Russia's doing this? And this is the way we'd like to do it, to standardize that across Mayo Clinic. So we can, I don't know if benchmark is the right term, but we can, it really is benchmarking for best practice. We can look at trends and get the preferred behavior that we want by looking at that, by having the vast amount of data available.
We've got another new one. Thanks, Don. We've got another question coming in from Kristen. Does Novolo handle tracking of part core returns and warranty replacements? And was that a requirement for Mayo Clinic?
I would say it's not a responsibility of Novolo to do that. It's really the specific vendors. So we don't return parts to Novolo. Novolo doesn't warranty parts. It's really the vendor. So it's really up to the vendor. If we order parts from PartsSource, they do that. If I order parts directly from Philips, Philips does that. The data is associated in Novolo. So we know if stuff has been replaced, but that's for the cost and et cetera like that. But it's really it's a vendor responsibility, but the data is reflected into Novolo. So Kristen, I'm not sure if I answered that question completely or as you're looking for, but it's really a vendor responsibility to do that.
Yeah, and Don, I would just jump in and say, like, from the PartsSource ordering perspective for your technicians, they can launch out from their work order and see all of their open exchanges, all of their open returns. And they can also, they have an interface when they enter that order, that if they enter an order for the same part on the same asset within the warranty period, it's going to flag for them and say, this part is still under warranty. Would you like to move forward with a warranty replacement? So the system automatically tracks it for them, and they're launching out via Novolo, but that functionality, to your point, is managed on PartsSource.com.
I will say, kind of related to this, we have wanted to know our bench repair, what's the cost of sending this device to different organizations. And in our old system with Lawson, that data simply did not exist. It was very frustrating that data did not exist. So we're going to have better data to do that now that we did not have yesterday.
Yeah, I was thinking, Don, when you were talking about other types of benchmarking that you're looking at doing as an organization, I was thinking that I don't know where, I've never asked you where Mayo is at with your AEM or alternative equipment maintenance type of work, or if that's something you're looking at, but it would seem to me that this increase of accuracy of data would help in that respect too, that if you do start looking at fleets and the types of repairs and parts you've had to replace on them, and looking at that in terms of an AEM schedule, that you're going to have better data to be able to make those decisions with.
Yeah, that's a great point, Mark, because we do as much AEM as we can. But yesterday it was a lot of manual data, so it's going to make it more accurate data and quicker means to get the data than it was before. That's a very good point.
One last question that's come in is, how did you engage internal and external resources to bring the vision to fruition? I guess the process.
It was actually easier with our external resources, Novolo and PartsSource, partly because Novolo was paid, and PartsSource was a very good partner with ours, and they were very interested and motivated to do this. With our internal customers, the Lawson and ServiceNow, it was just kind words and extra candy bars and extra cups of coffee to get them engaged. But it was not a problem. The Lawson, it took longer than anticipated, which may not be a surprise. And the Lawson people were very good in accommodating and say, Don, you said 6 months, but it's more than that. And but they were very good and very understanding. And fortunately, we had a relationship with the Lawson people previously, but with the ServiceNow people, we honestly did not, because HTM did not use ServiceNow previously. So that was new, but it was very good. And as I mentioned, ServiceNow is interested in, they want the Lawson order. They want to be able to understand that so other customers can use that to order Lawson parts. So they were, I guess motivated might be the right word as well, to engage in this activity.
Great. Well, if there are no further questions, I would like to thank Don, Mara, and today's attendees for your time. As a reminder, you'll receive an email follow-up that will include a link to the recording of today's presentation. And that email should be sent in 2 to 3 business days, sooner if possible. And I also want to invite all of the audience members to be sure and join us next Thursday, November 12th, for the final installment of the PartsSource HTM Leadership Series, Using Care Plans to Improve Patient Flow and Capacity, which will be presented by Doug Kursup, the Transformation Director at Ohio Health. So at this time, today's webcast is ended. Thanks for attending and have a wonderful day.
Thank you.